Hi there. I am making this video because I wanted to share my experience about getting esketamine treatments. The brand name is Spravato. When I was in the process of deciding to get the treatment and going through it, I searched for information online about what I could expect, and I found less information than I hoped for. So I wanted to make a video with the intent of hopefully contributing to the amount of resources that others can find online if they find themselves in need of perspective or in need of knowledge about other people who have gone through this. So it was recommended to me by my psychiatrist that I try the esketamine treatments because I have what is called treatment-resistant depression, which means that typical treatments have not been effective in managing my depression symptoms. And this typically means that 2 different medications have not worked from 2 different classes of medications. So those 2 classes would be SSRI and SNRI. The exact definition kind of depends. Just having 2 different medications fail doesn't seem that resistant to me, but for medical billing and insurance purposes, that's typically what constitutes treatment resistant, that you've been on 2 different medications from 2 different classes that have not worked. I've been on many more medications than that, but it wasn't until a more recent episode of severe symptoms that this was recommended to me by my doctor. At first, I was pretty nervous to try esketamine, brand name Spravato, because of the information that I found online, especially regarding addiction and possible side effects such as dissociation, and just the strength of this medication scared me. I felt like I was not sure if it could possibly make my symptoms worse or if it could leave me with a permanently damaged, permanently damaged brain. You know, if this somehow like burned my brain like acid or something like that. I just was pretty nervous, but I was pretty desperate. And when I found out that there was a clinic not too far from where I live that was administering esketamine treatments, I thought that I should give it a shot because it's still a pretty new and rare treatment, and the fact that I had the option of going to a clinic that was accessible to me made me feel that I should take the opportunity. So just to start with the basics, esketamine is a nasal spray. The brand name is Spravato. It comes in a nasal spray like you might administer like a Flonase or an allergy medication. It is different than ketamine, which I believe is a drug that has addictive properties. I think this one also does, but I think ketamine is more likely to be addictive. This is esketamine. And the treatment works by going to a provider or a clinic and receiving treatments twice a week for 4 weeks, then having an assessment, and if it's deemed to be helpful, having another twice a week, having it continue again for twice a week for 4 more weeks, total of 8 weeks. So that's what happened to me. I was initially given an intake appointment, and at that appointment, I was told to describe my symptoms, about my depression and the severity, and list the medications I had been on. And the intake clinician wrote a letter of recommendation to my insurance company saying that she believed I would be a good candidate for this treatment. And then I had to wait to get approved. And I was approved. It only took, I think, 2 days to get approved because I had been on so many different medications that it was quite obvious that I had what is called treatment-resistant depression. And the severity of my symptoms was such that I did fall into the category of needing a more severe, intense treatment such as this. So after my intake appointment, I believe it was only 48 hours, I received a phone call from the clinic that said that I could schedule my first session. So I would, because it's twice a week, you either do it like on a Monday, Wednesday, or a Tuesday, Thursday, you know, not back-to-back days. So I believe I think I chose Monday, Wednesdays. So I would do Monday, Wednesday, every week for 4 weeks. Then I was going to have an assessment and then see if I should continue. So I selected my time. I selected 3 p.m. because the treatment lasts only a few minutes, but you have to be monitored for 90 minutes to 2 hours after to make sure that your blood pressure doesn't change, drop, or raise in any concerning way, and also that you tolerate the medicine okay. So I figured 3 p.m. to 5 p.m., you know, end of the day, I'd still be able to get my work done in the beginning of the day. I was on partial disability from work, so I thought that made sense. So I chose Mondays and Wednesdays, 3 p.m. appointment, and then I would stay there till 5, and then I would leave for the day. And it's also worth noting that because this medication has, you know, effects of drowsiness, dizziness, disassociation, all those kinds of things, it's important to know that you will not be able to drive yourself and you will not be permitted to take public transit. Instead, you have to have a family member or a friend or somebody drive you and pick you up. Or you can take a cab or an Uber or a Lyft, but you have to assure the clinic that someone's going to be waiting for you on both ends. So if you can't get someone to drive you, you have the staff will walk you out to your taxi or Uber when they come, but someone should be waiting for you at home or at your destination when you get back to help you out, help you up the stairs, help you into bed, whatever. So I was fortunate enough to have a family member that was willing to drive me and stay with me throughout the treatment, which was very fortunate. Okay, so I wanted to give a little bit of background about what you can expect. So after you have your intake and you are approved by insurance and you've scheduled your first appointment, you're probably going to be given an assessment. So it would be like on a scale of 1 to 10, how many days in the past 2 weeks have you felt that your problems were unmanageable? On a scale of 1 to 10 in the past 2 weeks, how many days have you felt that you would be better off dead? You know, these kinds of questions to rank the severity of your depression. And then you're given a score. And then that score will be later compared to your midpoint score after 4 weeks. So you do that, then you walk in to the room where you'll be getting your treatment. For me, they were like small cubicle rooms with the lights dimmed, white noise machines, a recliner, like a lazy boy style chair, a blanket, and I also had the option of turning like Netflix on because it's going to make me drowsy, dizzy, and kind of space out a bit. So they wanted to give you like kind of a comfy, cozy environment. The temperature was a little bit on the cooler side, and like I said, they had the white noise machine playing and the lights were dimmed. So I went in, the nurse practitioner came in and demonstrated how to use the esketamine, and I would describe it as just like a nasal spray, similar to a Flonase or anything like that. I'm using this to demonstrate this little miniature bottle of mouthwash, just because it's a very similar size. You just hold it between your fingers like this, and then there's a plunger at the bottom that you press and spray the aerosol up your nose. So she or he, mine was a woman, would give you the bottle of esketamine, and it's up to you, the patient, to look at it and see that it's unopened and it has the 2 dots indicating that it's ready for use. You take it in your hand, and then I would always ask to do a practice run. So I would close one nostril, tilt my head back, and ask the clinician to confirm that it looked like I was administering at the right angle. So I would just do a practice one, and I would practice doing a big snort, because you have to do like a big inhale snort and it make a funny noise. So, and I'd say, does that look right? And she'd say, you know, usually I would do it fine. She'd say, yes, okay, fine. So then you do it, you put it up your nose, and the tip is tapered, similar to this tube of ointment. It goes up your nose, and you tilt your head, and you do a big snort. Okay, and then as soon as you do that, you're gonna feel like the chemical hit the back of your throat, and it tastes terrible. It tastes like rubbing alcohol, or possibly even like gasoline. There's a slight burning, and it tastes really awful. And you know, you might shudder, or you know, need a moment to you know, come to grips with that, and then you switch and you do the other nostril. So again, I would always ask for a practice round, just because I didn't want to make a mistake. So I would just hold it like this, and I would say, does this look right? And I'd practice plugging up the other nostril and doing a big snort. You can hear the funny noise I'd make, which is good. You're supposed to make a snorting noise. My clinician would say, yes, looks fine. And then I would insert the tip my head, and do that snort. And you would feel the mechanism click, meaning that you've administered the dosage. Again, you're going to feel the medicine hit the back of your throat. You might feel a slight burning and a really disgusting taste in the back of your throat. And if that's your first session, that might be it. If you've already had a few sessions, the clinician might come back in 10 to 15 minutes and have you do another dose, the exact same thing. You tilt your head, you insert the nozzle, you give a big snort, you wait a few seconds, you block the other nostril, tilt your head, do a big snort. So once you have the medicine in your system, at least for me, all of a sudden I started feeling a little bit slow, a little bit dizzy. I was in the soft recliner chair, so I would just kind of close my eyes and sit back, and pretty instantly I would start to feel this sense that the room was expanding, almost like everything was moving and floating like the contents of a lava lamp. So I was conscious, I was coherent, I could talk, you know, I had my family members sitting there with me. So I was talking, maybe I was talking a little bit, maybe I was saying some things that were a little bit strange or funny, like you might do if you're half asleep, making some weird comments and stuff, but I was still able to talk. I wasn't asleep, but I had this sense of this kind of sleepiness, dreaminess, and this sense that I was in sort of a lava lamp and everything was kind of flowing and expanding. And that lasted for about maybe 45 minutes. And then after 45 minutes, those symptoms or those reactions would kind of come down. And then by the full time that I was at the appointment, after 90 minutes to 2 hours, by the end, I would just feel kind of sleepy and dizzy. And that's when I would be escorted out and driven home. And I'd probably just have to take a rest for the rest of the day. I wanted to give some tips on how to get through these treatments, because it's pretty intense and it's pretty uncomfortable. And I didn't really know any tips ahead of time. So what I would say is, before you go, make sure you blow your nose and, you know, take care of all that, because you're going to be snorting really hard. And you don't want anything up your nose. So if you're having any nasal issues or you have a cold or anything like that, just, you know, make sure you clean all that out with a Q-tip or blow your nose ahead of time and make sure you're all in good shape. The other thing I would say is, because the medicine tastes so bad, I would recommend a sucking candy. I used these Gin natural ginger candies. The benefit is they have a really spicy flavor that kind of coats the mouth, and also ginger helps with nausea, which I did experience. So I would recommend a candy like this to suck on. You can chew these, but they're very sticky and they might pull your fillings out. Also, a candy that might work would be like those cinnamon fireballs. I just think those two flavors, ginger or cinnamon, would be the best, because they do have that spiciness that kind of numbs up your tongue. I would find, for me, I would find a Jolly Rancher, like a fruit-flavored Jolly Rancher or a cough drop, too nauseating. Those kind of sweet fruit flavors, I would find that too nauseating with this medication. So that's my recommendation. You use something like spicy, ginger or cinnamon. The other thing I would suggest is getting an anti-nausea medication right off the bat. So when I went in for my first treatment, they said that they could prescribe me a medicine to combat nausea if I experienced it. And I actually went to maybe 2 or 3 treatments before I kind of broke down and said, yes, I need the anti-nausea medication. I don't know why I was resistant to it, but I just thought I could power through it. But I did experience severe nausea, so I was given the prescription. The prescription is for a drug called, I don't know how to pronounce it, but I'm going to say it, ondansetron, 4 milligrams. I'll put the name of it in the description. ONDANSETRON, 4 milligrams. And this was a medication that I would take before my treatments to help combat nausea. So I would actually suggest that on your first day, you ask for a prescription of this just in case. And if it turns out that you're made nauseous by this treatment, you just have this, take it before you go to your treatment. The next thing I would say, back to the things that helped with the disgusting taste, I would recommend bringing a carbonated beverage, either unflavored seltzer water or something with, again, like a spicy, overwhelming flavor. So a ginger beer, like one of those natural ginger beers, ginger ale, or root beer. Maybe Coca-Cola too. I personally would stay away from any type of fruit flavors like Sprite, which has the lemon lime flavor, or orange soda, obviously grape soda, any of those like fruit flavored drinks, because to me, the nauseating feeling would be intensified by a fruit flavor. So that's what I did. I would start before I did my snorting, I would put this spicy ginger candy in my mouth, suck on it for a little bit just to kind of numb up my tongue in the back of my throat a little bit. Then when I would snort, I'd take a sip of that carbonated beverage and hold it kind of in the back of my throat, almost like I was going to gargle, because the bubbles carbonated and everything in the back kind of helped move that nasty taste along. And then the last tip I would give is, well, I have 2 more actually. The next to last tip I would give is to bring a bland snack that can take the taste out of your mouth. So what I did was I brought pretzels, mini pretzels, and peanut butter. It's bland enough. It's not going to be like crackers and cheese or fruit or anything like that. That's going to be, not incompatible with the nauseated feeling. It's pretty bland, but the peanut butter again has that overwhelming flavor that can kind of cover your mouth. Typically I would buy like the natural peanut butter because I avoid added sugars and I avoid hydrogenated oils for health reasons. But for this, I didn't want to mess around with anything like that. I just wanted the basic stuff. So I got just the regular peanut butter, Jif, Peter Pan, Skippy, whatever you get. And I actually ahead of time would put a little bit on pretzels and put it in a little Tupperware. Not too much, because again, you're not going to have any appetite when you're in there. You're going to feel pretty sick to your stomach. At least I did. So I just had like a couple pre-made. And then when I was in there, if my stomach started feeling upset, or if I had that taste that I couldn't get out of my mouth, I would just have a couple of those pretzels with the peanut butter pre-portioned out. So those are my tips regarding the nausea and the taste. And, preparing your nose for doing that like intense snorting. And then the last thing I would say is wear sandals or slides or shoes that you can slip your feet out of, because, you're going to be sitting there for 2 hours. You are going to be probably spaced out, dizzy, kind of in a dreamlike state. And it can be nice to slip your feet out of those shoes, sit cross-legged, or, put a blanket over or something like that. Can be more comfortable to, sit in that way rather than be in your shoes. That's just my tips. So I went over quite a few things in this chat with you. Basically how I came to be recommended to do the esketamine treatments, some of my fears, such as, fearing that this would, I would have a negative effect, negative reaction to it, that it would somehow damage my brain, almost like a lobotomy. I was scared of that. Of course, at that time, my symptoms were so severe that I was scared that it wouldn't work. I was scared of the commitment. I was scared of the financial burden. I was fortunate that it was covered in full by my insurance. I eventually did make the decision to go through with it because I felt that it was sort of a gift that my insurance was willing to pay in full, and that a clinic was nearby, and so many people don't have that option. I felt that I couldn't pass up the opportunity to at least try this new treatment. I spoke a little bit about what it takes to qualify for this kind of treatment. You have to be diagnosed with treatment-resistant depression, so 2 or more medications of different classes, SSRIs and SNRIs, have to have failed to alleviate your symptoms. I spoke a little bit about how they will give you an assessment before you start to just judge your score, and then what it feels like to go through the treatment, so going into the dark room, probably being put in a soft chair and being administered those nasal spray canisters or administrators similar to a nasal spray that you might take for allergies. And then my tips for getting through that. I will say that this treatment was not effective for me. Fortunately, I did not have any negative side effects. I did not have any psychosis or loss of touch with reality, so no negative side effects like that, no addiction or anything of that nature. But it did not help my depression. So if you are considering this treatment and you have treatment-resistant depression and you have the opportunity to try this, and you're fortunate enough to have someone who can drive you, and insurance is willing to cover in full or in part, my recommendation would be to try it, even if it doesn't work. It didn't have any negative effects for me, and sometimes it can give you peace of mind to know, at least for me, it can give peace of mind to know that I tried everything I could and that I didn't leave anything on the table. So that's just my perspective. I'm glad I tried it, even though it was not effective. I didn't have any negative side effects, and at least now I have some perspective and experience that I hope can help others, and I still hope and believe that this can help other people, even though it wasn't effective for me. So the way it was determined that it wasn't effective is after 4 weeks, so that would be 8 sessions because they're twice a week. I was given a repeat of the assessment, on a scale of 1 to 10, rate how many days in the past 2 weeks you felt that you'd be better off dead, that you felt that you couldn't stop worrying, those questions. And my score had not really changed. So after that, they said, okay, we don't see an improvement here. We can't really ask insurance to continue covering this. This treatment has been deemed not successful. Basically, good luck. If I had needed their psychiatric care, I think they would have connected me with a psychiatrist, but I already had one. And yeah, so disappointing for sure, because I was hoping that would help me, but I am no worse for trying it, and I'm glad I did. So I hope these tips help other people, and that this was, I hope that, my experience can be beneficial in increasing the amount of knowledge available online for these treatments to help others. So thank you for listening, and I'll put some info in the description. Thanks.